So the injuries of the upper limb. Another topic is the anatomical snuff box, which are not included in the previous lecture. Anatomical snuff box is actually the triangular depression which is lie on the radial or dorsal side of the hand, and the medial border or the ulnar side of the anatomical snuff box is actually formed by the external pollicis longus tendon, and the lateral border or radial side is actually formed by the external pollicis brevis tendon and abductor pollicis longus tendon. And the floor of the anatomical snuff box is formed by the scaphoid and trapezium. And what is the main content of the anatomical snuff box? It is actually the radial artery. As you will see here, the extensor pollicis longus tendon will form the medial border or ulnar side, and the radial border is formed by the tendon of external pollicis brevis and extensor and the abductor pollicis longus tendon. This is the another picture of anatomical snuff box. And what are the contents of the anatomical snuff box? Anatomical snuff box has the radial artery, which is lying on the scaphoid and trapezium in the snuff box, and the cephalic vein and superficial branch of the radial nerve. And while you will see here the extensor pollicis longus, which will lead to the which will reach to the base of the distal phalanx, extensor pollicis brevis, which form the radial border, and abductor pollicis longus, which is at the radial border or the lateral border of anatomical snuff box. Clavicle fracture. This is the most common area where the clavicle get fractured. It is actually fractured due to the fall on the shoulder or outstretched hand, and it can also be fractured during the delivery through the birth canal of the baby during the breech presentation. Its fractures occurs most commonly at the junction of the medial and lateral thirds. This results in the upward displacement of the medial fragment and downward displacement of the lateral fragment. Upward displacement of the medial fragment occurs due to the attachment of the sternocleidomastoid muscle at the medial side. So the medial fragment moves upward while the lateral fragment moves downward. Significance: it may cause injury to the brachial plexus, most commonly the lower trunk. Fatal hemorrhage can occur from the damage to the subclavian artery, and the thrombosis of the subclavian vein may also occur. So, as I've already told you, the medial fragment moves upward due to its attachment to the sternocleidomastoid muscle, and the lateral third or lateral fragment of the clavicle moves downward. Fracture of the humerus. These are where the marking has been drawn. These are the most common site where the humerus can be fractured. First site of the humerus fracture is the surgical neck. At this site, the axillary nerve can be damaged, as well as the artery, posterior humeral circumflex artery, which can be damaged or injured at the site of the surgical neck. When there is a fracture, when the site of the fracture of the humerus is the shaft, then the radial nerve and the profunda brachii artery can be damaged, can be injured. When the site of the injury is supracondylar, then nerve is the median nerve and the artery is the brachial artery, which can be most commonly injured. The other site of the humerus fracture is the medial epicondyle. And while at the medial epicondyle, as the ulnar nerve pass dorsal to the medial epicondyle, so it is the most common nerve which can get damaged, and the artery is the ulnar collateral artery. As I've already explained you in the previous slide, the sides as well as side where the humerus can get fractured, and the most common structure which can be injured due to the fracture. So you can see here common surgical one common site is the surgical neck of the humerus, and it will cause damage to the axillary nerve. The fracture at the shaft of the humerus will lead to the damage to the radial nerve, and the supracondylar fracture will lead to the damage to the medial nerve, and the fracture of the medial epicondyle will lead to the damage to the ulnar nerve. This is the common means the root of the nerves and the arteries, so you can better understand at the site of the fractures which vessels and which nerve can be get injured. What is the Colles fracture? It is actually the distal radius fracture in which the distal fragment is displaced or tilted posteriorly or dorsally. It produces a characteristic bump described as a dinner fork deformity because the forearm and the wrist resemble the shape of the dinner fork. It may cause the damage to the median nerve. If the distal fragment is displaced anteriorly, then we label it the reverse Colles fracture or Smith fracture. So this is the most common Colles fracture, which is the fracture of the distal third of the radius, and it is most commonly occur in the older age man or woman. So it will look like a dinner fork. And the another type of the fracture, when the distal third move anteriorly, we will label it the Smith fracture. This is the another diagram, means the Colles fracture, the distal third is moved posteriorly, while in the Smith it moves anteriorly. Now the fracture of the scaphoid, this is the different type of the fracture which I have shown in the at the right side. It actually at the left side, the fracture of the scaphoid, it occurs due to the fall in the outstretched hand and cause the deep tenderness which will be felt in the anatomical snuff box, as I have already explained in the first or second slide. It will cause the damage to the radial artery and can cause avascular necrosis of the bone and degenerative joint disease of the wrist. Actually, there are the two bones in the body which can be affected, and which will lead to the due to the fracture of these bone, which will lead to the avascular necrosis. First is the scaphoid, and the other is the other bone of the body is femur. The head of the femur, whenever there is a fracture of the neck of the femur, which will lead to the avascular necrosis of the head of the femur, and another bone which can be affected by the avascular necrosis, it is the scaphoid. Now the fracture of the hamate, it leads to the injury of the structure which is close to the hook of the hamate. And what are these structures? It is actually the ulnar nerve and ulnar artery. So this is the hook of the hamate, and the deep branch of the ulnar nerve and artery is shown here in this diagram.